health. Very similar to what happened about 45 years ago when a gentleman named Dr. Cooper observed that there was something different than just lifting weights. That health was more than just big muscles. And he wrote a book called Aerobics and just revolutionized the whole health and fitness industry. I have a quick question for you. Aside from people who have practiced Tai Chi in the past, how many of you know what Tai Chi is or are familiar with Tai Chi and Qigong? So you got a fair number of hands here, which is great. 10 or 20 years ago, there would have been a lot of blank looks. Tai what? How many of you can tell me what Tai Chi is? Why do people do Tai Chi? You get one volunteer here that hasn't done it before.
That hasn't spoken or
no, hasn't done it before. We'll go.
Done Tai Chi?
Yeah.
I haven't done it, but it was recommended to me by a physician who practices integrative medicine as a way of controlling your breathing and something on the level of meditation along those lines.
Something on the level, and that's it. You know, it's a very nebulous concept. A lot of people, they hear about Tai Chi, if you ask actually the majority of Tai Chi teachers out there, why should I do Tai Chi? They'll say it's because it enhances your Chi. It's like, Chi, okay, I've seen that in the movies. Well, what does that mean? Because, well, your vital energy. Okay, vital energy sounds good, I like energy, but what does that mean? That's as far as it goes. There's been a lot of research on the health benefits of Tai Chi, but you have the scientists on one hand that know how to research things. You have the Tai Chi instructors on the other hand that know about Tai Chi and it's something that they love it and they've invested a lot of their personal energy and identity with, but they've never really quite gone beyond, hey, I feel good, it makes me healthy, and we'll cheat, that sounds good. And so you got all these studies that are showing benefit after benefit after benefit for exercises like Tai Chi and Qigong, which is kind of a related exercise, but very little understanding as to exactly what's going on the body. And if you're getting physiological benefits, it means there's something measurable physiologically that's going on in the body. With Dr. Cooper, he made observations with the heart rate and the cardiovascular effect, and he wrote that book, Aerobics, kind of explaining the whole situation. Since MetaAerobics is about moving in ways which stimulates your body to heal itself, from a very basic perspective, we're going to have you all stand up. We're going to do a little bit of a kind of a preliminary exercise here, just kind of get the body moving. So if I can get you all up, and we're going to start with just a gentle kind of spiraling exercise. There are some very physiological things that go on, but some of it's very structural as well. And your spine is connected to every part of your body. All the nervous system goes through that. And we tend to treat our spine like a 2x4. But if you've ever seen it, it's more like a series of blocks or beads on a string. And it should be something that's very flexible, that can move. So all day long, we sit at our desk, our spine's sitting there, frozen immobile, and we get all these back problems, and then we ask why. We tend to carry a lot of shoulder stress and tension. So this exercise here helps to loosen up the shoulders and the back and the hips and the knees. And then there's a few other things you could be doing here. As you're rotating, you can let your back, your side of your hand hit the upper chest. That will shake up the upper chest, kind of vibrate it a little bit. And if you've been around dust, pollution, if you've been sick, you'll find this actually brings up whatever's been junk's been accumulating in your lungs, and you'll actually find yourself sometimes coughing up whatever's down there in the lungs that you don't want down there. When you strike the kidney area here, that helps shake up and vibrate, stimulates the kidneys a little bit, and may help prevent things like kidney stones and the like. This is all a very new field, so a lot of this needs to be researched and validated exactly what's going on. My work with MetaAerobics is an initial start of looking exactly what's going on in the body and why. Okay, I'm going to bring you through one Qigong exercise. Tai Chi is a form of Qigong. Qigong can describe a vast array of exercises, so you kind of got to be careful. If you go out and look for a Qigong class, you never know what you're going to get. Qigong is very synonymous with the English word exercise. So if you go into a gym and say, I heard exercise is good for me, and you go up to some guy that's bench pressing 300-pound barbells, that's not going to be good for you. So you want to understand a little bit about what Qigong, but a lot of Qigong holds similarities with Tai Chi, which is based on increasing the oxygen consumption in the body, going through a range of motion. So we're going to start with a preliminary exercise. It's called Drinking from the Well from the 8 Treasures. I'm going to breathe in, let the hands rise up. This is going to expand the chest, expand the abdomen. Breathing in and out through the nose, and breathing out. The hands just drift down nice and relaxed. As you press down, like you're pressing on a table, your spine's going to tuck forward a little bit, You get a nice stretch to the lower back, which is wonderful because we store a lot of tension through here. And keep that back nice and straight. Breathing in like you're bringing up a handful of water. Turn that hands over and breathe out, pressing down. Straightening that spine again. Breathing in. Hold the breath. Press up once, twice, and breathe out. Now holding breath kind of helps pressurize the body, create kind of a reverse osmosis effect. We're going to do that 2 more times. Breathing in. The breathing's deep from the abdomen using the diaphragm. Breathing out, we're going to press to our right here. So we get a little more twist to the spine. Breathing into the center, cupping the hands. And breathing out. Pressing down, straightening the spine, nice and gentle. Breathing in. Hold the breath, press up once, twice, and breathing out. We'll do that one last time. To the left. Straighten the spine. Breathing in. Expanding the abdomen, expanding the chest, getting a maximum oxygen into your body. Breathing out. Breathing in. Hold the breath. And breathe out. That's the first movement from the H treasures. Now have a seat, and we'll go on with the rest of this here. So you look at that, and it's like, okay, you get kind of a nice stretch. I can see I'm doing some deep breathing, but how is that going to benefit me? How is that going to help any condition that I have, other than maybe just this gentle stretch or relaxation here? What got me started looking in this direction is a student I had, her name was Karen. I'd been teaching Tai Chi at a community college for about 10 years, and over those years I've had people with various chronic conditions that came up and they said, hey, Tai Chi really helped with this. 3 of these students had cancer. Their cancer wasn't responding to treatment until they started doing Tai Chi. But the most dramatic of these was Karen. She came to my class. She had lost all of her hair from chemo and radiation therapy. Her doctor said, Karen, nothing's working. Cancer's throughout your body. You have about 3 weeks left. All we can do is put you in palliative care and try to make life comfortable for you in your final days. She wasn't ready to give up. And she'd read about a gentleman who had brain cancer, a tumor in his brain, that did some Tai Chi and Qigong exercises, and he got better. So she came to me at the class of college. She said, Dr. Gryffin, I'm dying here. Is there anything that this will help with? At that point, I was doing Tai Chi for general health as a martial art. It is a form of martial art. And I've heard these stories. I said, I don't know, but let's give it a shot. I went home. I made her a video that night that talked her through the form, walked her through it the next day. She started doing it daily.
Excuse me. I missed the point. You video of what?
A video tape of myself doing these exercises. I made a video of the Tai Chi exercises.
Okay. Thank
you for slowing me down. So I get so excited about this. It's that whole, you start just going 100 miles an hour here. So I made her a video, and she started doing these exercises. Within 10 days, she was completely off of morphine. Up to this point, she's taking 5 maximum doses of morphine a day for the pain. That's one of the things that's been universal with the Tai Chi exercises and the Qigong exercises across a wide variety of studies and conditions as benefits for chronic pain. So within 10 days, she was off of morphine. 3 weeks came and went, she was still alive. 3 months came and went, she was still alive. She moved after about 2 years to Montana with her family to fulfill a lifelong dream. I know I had some contact with the family, and she lived at least another year. She did finally succumb to cancer, but she was given another 3 years with her family. That made me start wondering, well, what's going on in the body? Why would something like Tai Chi, these slow, relaxed breathing exercises, have such an effect on the health in the body? So I started researching, and what I found was that tumors in the majority of forms of cancer, as they grow, they distance the capillaries and they create these hypoxic or oxygen deficient areas. The oxygen cannot get into where the tumors are. And a lot of chemo and radiation therapy is dependent on high oxygen saturation in the areas. So it seemed like there might be something to do, if Tai Chi helps bring in oxygen into your body and helps your body use oxygen, then maybe there's something having to do with this. And then if you look at the second illustration here on the other side here, the tumor mass, this is actually from a study that was done by Malachi in Purdue University, Indiana. And they were looking, there's a lot of ways that they look at boosting the oxygen saturation around tumors. And one that some use different drugs to try to boost the oxygen area. He developed a tiny little implantable micro oxygen generator that he put on the tumor, implanted it on there on mice. They haven't quite developed this for people yet, but they had these mice with these horrible tumors. They planted this micro oxygen generator on there that was ultrasonically powered and generated high levels of oxygen around the tumor. The tumor shrank and became benign, and the mice lived. So from a theoretical perspective here, if you're doing these exercises that are focused on relaxing the muscles, bringing in extra air, bringing in extra oxygen, and using it, maximizing the use of the oxygen in the body, this would explain how and why exercises like Tai Chi might have such a benefit for chronic conditions, including cancer. So I started measuring. You can measure oxygen saturation using a little fingertip pulse oximeter. So I thought, let's see what the oxygen saturation is, how it varies from exercise to exercise. And if you look at this is the heart rate here, and here you have the heart rate during Yang style Tai Chi, grasp the bird's tail, which is the specific section of Tai Chi. Walking, it occurred to me that walking is not really truly aerobic. It really doesn't get the heart rate up to really maximize the aerobic benefit. And so it occurred to me that exercises like walking, you're focusing on breathing, the range of the nice, slow, relaxed walk through the park, so to speak, that maybe walking has an aerobic effect. So I thought, well, let's measure walking, regular walking, and walking when you're really focusing on relaxation and maximizing the breath. And then at a moderate run, and then a high intensity run, and then the heart rate at rest. And you'll see as the heart rate goes up, over here we have oxygen saturation. So the blood oxygen, the amount of oxygen that saturated in the blood during Yang style Tai Chi and went up to almost 97%. This is averaged over 50 people. Grasp the bird's tail, it actually went up to almost 98%. When we had people walking with a focus on the breath and relaxation, it went up to over 97%. Regular walking, where people are just walking and not really paying attention to the body or the breath, it increased a little bit, not quite as much. It wasn't statistically significant, but you did get a little bit of an increase over resting. And then you have over here, moderate run. You actually, the far end here, you have the oxygen saturation at rest, which is just under 96%. When you ran, it dropped down to 95%. If you did a high intensity run, it dropped down to 94.2%. This is averaged over 50 people. But one thing that was consistent is the higher the intensity of the exercise, the oxygen saturation would either stay the same or would drop. The slower, more relaxed you were, the more focused on the breath, the oxygen saturation would go up. And here you have these tumors which are affected by the amount of oxygen saturation in the area. So there seems to be a direct tie-in here between the two.
So you're saying aerobics is counterproductive to what you're talking about?
It's counterproductive to increasing oxygen saturation throughout the entire body. It is productive towards increasing cardiovascular health. Cancer is almost unknown in the large muscle groups. And my theory is that part of the reason maybe is that muscles are such an oxygen-rich environment. When you exercise, when you run, you're not supposed to run on a full stomach because you get the stomach cramps. When you have a full stomach, the blood flow goes to your stomach because your body wants to digest that food. And so you get the muscle cramps and the stomach cramps. If you're running on your empty stomach and all that, not all the blood, but you're getting the blood shunted primarily to the large muscle groups, not necessarily starving the organs, and this is something that I want to look at and research along the line, but looking at how does oxygen saturation, do you get a lot of variation between the organs versus the muscles? The measurements that I can do right now are using a fingertip pulse oximeter, so we're looking at primarily the capillary blood flow in the extremities. But do you get it different in the organs? So running aerobic exercise is still fantastic for you because it increases the cardiovascular health, but here's something that shows these slow, relaxed movements, focus on breathing and relaxation, may boost oxygen saturation and oxygen delivery throughout the entire body. Oxygen-based metabolism underlies every function. You can only go a few minutes without air. If you were to be in an airtight room, you can't last very long. So oxygen-based metabolism is something that underlies that. And that's actually where I was looking at, okay, you got aerobic exercise, you got anaerobic, which is the chemical-based without without like the weightlifting. So we need a new area here because frankly, this Tai Chi and Qigong, this is not aerobic. There are Qigong exercises where you're standing almost completely stationary. And so I realized you need a whole new category of exercise, and I coined the term metaerobic because it shows that it's enhancing oxygen-based metabolism. For the folks that are enhancing oxygen-based metabolism. This here is the hand of Chen Nanqing. He is a famous Tai Chi teacher from the last century. This is his hand at age 72 years old. This is a 72-year-old man's hand. It's been set, one of the slogans in Tai Chi is, as you do Tai Chi in China, they say you develop fair lady hands. I'm not sure if that's a goal of a lot of guys that want fair lady hands, but the idea is in China it's seen as having youthful, smooth, supple, firm hands. And the reason for this may very well be that you're just enhancing the oxygen saturation, the oxygen diffusion throughout the body. You'll feel as you do these exercises, you'll feel a tingling in your hands and your extremities from the increased blood flow. When you sit on a limb and it goes to sleep and you cut off the blood flow and you get that painful tingling, that painful feeling, well, this is just like that, but it's pleasurable because you're enhancing the blood flow in the body. You'll feel that in the extremities. So I'm going to show you one more slide here, and I'm going to get you up and do a couple more exercises here so you kind of experience this more yourself. So what you're really working on is relaxing the body, getting more airflow, blood flow, and that is tremendous for a lot of chronic conditions. I'm going to try to share 3 of these with you here. So one of the most studied areas has been blood pressure, because the idea is relaxation should be good for bringing down blood pressure. Gloria with the Harvard Medical Institute, she's did a review of 22 studies. They all showed a significant positive effect of Tai Chi on blood pressure, reducing blood pressure. When you relax muscle tension, it also reduces the tension in the arteries. It will reduce your blood pressure, and that is fantastic for your health. So a simple exercise that you can do for that, we can kind of test and evaluate that. I'm going to go ahead and pause this here for just a minute. I'm going to get you all up again. I'm going to do another Tai Chi exercise here. The first thing we're going to do is test the amount of stress and tension, muscle tension that you have in your body. So I want you to stand with your hands relaxed at your side, and then I want you to look down at your hands and take a look and see how claw-like are they. The more claw-like they are, the more tension you have in your body. If you're totally relaxed, your hands should be hanging like this. It's muscle tension that curves them in. Gravity pulls down. Muscle tension curves everything in. So that as you're going through here, grabbing the steering wheel because somebody cut you off, you're at work, and just this tension, it crunches your shoulders together, crunches your back, crunches your hands, you'll see that. Tai Chi practitioners, you can kind of gauge the level of their experience and expertise. I look at their hands, and if their hands are hanging fairly close to straight down, I know that, hey, these are people that really do their Tai Chi every day. A lifetime attention, I don't think I've ever seen anybody where their hands are totally relaxed, but it's one way that you can gauge the tension. One thing that we can do to kind of help release some of that tension and bring in the extra oxygen is the opening and closing from the beginning movement of Tai Chi. So you're going to stand here with our feet about shoulder width apart. Even here, our hips are tucked forward just a little bit, like there's a string pulling down on the tip of the spine, and a string on the crown of the head pulling up, so you get a nice stretch to the spine. We're going to breathe in, really relax, let the hands float up like they're floating up through water. And then we're going to breathe out, let the hands drift down through water. As they come down here at the bottom, you can press down like you're pressing on a table, and that'll help release some of that tension. Breathe in, expand the stomach, expand the chest, and breathe out. Chest contracts, stomach contracts, getting all that air out. Press down, breathe in, and out. Tai Chi and Qigong can be as complex or as simple as you want to make it. Just doing this for 10, 20 minutes, if you want to do it for an hour, you're going to feel that effect. You might start feeling, I've been doing this for a while, so I feel that tingling right off the bat. But if any of you press down here slightly, if you feel that tingling in your hands and your fingertips, that's that increased blood and oxygen flow. Diaphragm comes down, stomach expands. Ribs expand, lots of air. And we'll go ahead and move into one Tai Chi, the ward off from the grass to the bird's tail section. Grass to the bird's tail is where you get the highest oxygen readings. So I want you to shift over here onto your left leg. And you're going to wave hi to me, but let your wrist be nice and relaxed. Reach back like you're holding a big beach ball. And you're going to step out a little bit with your right foot. And shift the weight forward and roll that ball over like you're going to offer me a towel. We're going to just do that back and forth. Shift back, let the hand float back again. Make the big ball. And shifting forward. Shift back, breathing in. And the ribs, the chest, and breathe out. And the weight just shifts back and forth like the rocking of a boat on an ocean, which is very relaxing. We can also shift feet. Step together. Step out to the right. Shift the weight back, make the ball on the other side. And step out with the left. Do that again, shifting back. Step out. Actually, Tai Chi is also an excellent exercise for the balance. And step out. The eyes focus on the hands. Right now they can focus on me because you got to see what you're doing. But as you get comfortable stepping back, the eyes focus on the hands. And it's just like a sitting meditation, but instead of counting the breath, do that 2 more times. Instead of counting the breath or focusing on mandala or other focal point, you focus on the hand. Breathing in and breathing out. 1 more time. This is from grasp the bird's tail, the first movement. And just this extra movement, you're focusing, just totally relaxing. This hand just floats up like it's floating through water. This hand presses down, or you can let it flat. Here, we'll close it up, step together, breathing in. And out. And you can have a seating along that. All the breathing is done in and out through the nose in most forms of Qigong and Tai Chi. The Chinese have a wonderful saying about this. They say, you wouldn't shove food up your nose, so why would you breathe through your mouth? Biologically, physiologically, the nose is designed for breathing, the mouth for eating. When you breathe through your nose, it helps pre-moisten and pre-warm the air before it gets into your lungs. It also helps trap any pollutants or dust or germs that are out there, helps your body get rid of it. When you breathe through your mouth, it just goes straight into your lungs without any filtering, without any pre-warming. The nose is specifically designed for healthy breathing. So, from here, I'm going to share a couple of stories. The research is fantastic. The research is fantastic for this in that there's studies that are showing benefit after benefit. But I like looking at the case stories. And on the MetaRobics Facebook page, I have hundreds and hundreds of case stories for different conditions. On this, the one for the heart surgery I find very interesting in that Maggie, she ended up being scheduled for heart surgery because she went in for a stress test and she's there on the treadmill and the doctors immediately stopped the test and rushed her into surgery. Her arteries around the heart were 90% occluded. They were just filled up with cholesterol to where her arteries supposed to be like this. They were like this much blood flow going through, 90% occluded. And the doctors were saying, you didn't feel any effects, no shortness of breath, no chest pain? She says, no, I feel fine. She realized it was probably because of the Tai Chi, her body was so relaxed and using the blood and the oxygen so efficiently that even though she only had a 10% opening there, that her body was able to function on that. Doesn't mean that sooner or later she wouldn't have a heart attack, but it kept her alive and well until the doctors found out she had that condition. Now she does a rigorous walking program and Tai Chi. So the Tai Chi, the MetaRobics, it is great for chronic conditions. You still kind of need that cardiovascular. You still need to take care of your heart. But one thing that was interesting was after surgery, the doctor said she would need a pacemaker because her heart wasn't establishing a regular rhythm. She said, she had this feeling, you know what, can I do Tai Chi for a little bit first? They went to go set up the operating room. She went and did her Tai Chi. They came back, her heart had established a regular rhythm. She didn't need a pacemaker. This is not the only person that's told me this. Another person who actually had a pacemaker started a Tai Chi class. Their heart started self-regulating. They were able to take out the pacemaker. Another person who told me that he was a long-time Tai Chi practitioner, didn't do any other kind of exercise, had a little bit of weight, went in for a stress test. The doctor said his arteries were 95% occluded. They had no clue why he was not feeling any effects of this at all. But, so it really helps with that. It helps with your blood pressure. She didn't want to take drugs, so she took Tai Chi. Her blood pressure gradually dropped, and whenever she feels stressed, she could just use this open closed breathing, or there's another one where you just kind of breathe in and out, and her blood pressure just drops immediately. A lot better than popping a pill, which tends to have some unpleasant side effects. So for heart disease and heart conditions, blood pressure, this is an excellent exercise. It doesn't replace totally the cardiovascular health, but if you have a chronic condition, if you can't get out there and hit the treadmill, if you can't do the cardiovascular exercise, it helps your body work more efficiently. Arthritis. Tai Chi, this is something I posted recently on the blog on the Metarobic Institute website. I was looking at the research on arthritis, and there's a study that took 295 rheumatoid arthritis patients, and they enrolled in the study. Now, one of the shortcomings with studies in Tai Chi in America is that we like things quick and short and easy. So they'll have people come in for maybe 2 or 3 times a week, do Tai Chi for an hour. Usually they're learning Tai Chi versus actually doing it, and they're still getting remarkable benefits, but not necessarily 100% cure rate for a lot of conditions because they're doing it 2 or 3 times a week for 30, 60 minutes. Well, this study is conducted by doctors with New Jersey Medical University, but they're conducting it in China, and in China, the idea that you can do these exercises that they're going to cure you, they have faith in it. Just like here, you're told if you need to run, if you need aerobic health, you understand that, you realize, hey, if I don't do this, I'm going to have a heart attack, I've got to do it. In China, they tell you they're going to do Tai Chi or Qigong, it may cure your arthritis. They understand that, and they'll try it. And so they have these people doing it for 3 hours every day. That's a lot to ask for anybody. Now, this is the initial period. They're able to tone it down to less and less time as they went along. What was amazing is at the 2 and 6 months follow-up, within 2 months, 192 patients out of almost 300 with rheumatoid arthritis, which is awful things to your body, reported complete recovery. Their arthritis went away. They have a lot of case stories along this line. So pain, impaired joint function. 83 patients experienced significant improvements. The pain went away, joint function was better, and so on. Only 6 reported minimal benefits. And the question he's asked is, were these guys doing the 3 hours of Qigong and Tai Chi? But just seeing these effects, and that's something that dosage really needs to be applied to. If you have a chronic condition, I'm going to save any other questions for the very end. I know we're needing to wrap up here in a few minutes. But if you have a chronic condition and you are looking at not being able to use your hands, not being able to walk, there's people who are confined to wheelchairs who started doing these exercises, and that's actually, I believe, one of the case stories here. The doctor said she needed a wheelchair soon, and she could barely stand when she started Tai Chi. Started doing it every day in her wheelchair so she could do it standing. 2 years, she was pain-free and able to walk on her own. She completely recovered her former health and mobility. This person had arthritis in their hands, their fingers were swollen and in pain, and after the Tai Chi, their hands returned back to normal. Their bone density also increased. Benefits from arthritis are one of the largest number of case stories they have. A lot of them relate to benefits for arthritis. Dr. Paul Lamb at the Tai Chi for Health Institute, he started this because he couldn't hold his briefcase anymore. And so he started Tai Chi, and he recovered from his arthritis and started teaching it to others. Immunity. Tai Chi has this wonderful effect. It boosts your T lymphocytes to help fight immunity. And they found that at Tai Chi, the T lymphocytes were 173% at 3 weeks. At 20 weeks, their immunity was still at 109%. The people who got the shingles vaccine group, at 3 weeks, only 58%. At 20 weeks, only 10%. With the Harvard Medical Center, the vaccine group increased by 75%. This group, the Tai Chi, the Irwin's group received the vaccine and did Tai Chi. Her group, she thought, what happens if you just do Tai Chi? Just Tai Chi with no vaccine, she got a 50% increase in immunity. The comparison group, they had a comparison group, there's no change in immunity. So if you look at some of the stories, this person started because of their heart attack and it's got constant pneumonia, flu, bronchitis. And then the second heart attack, I learned about Tai Chi, they started doing it, and has now been sick in 2 years. This person had hepatitis C, which ravages the body in horrible, horrible ways. She improved her liver pain, her muscle and joint discomfort, and she credits it with giving her life back. Myself, since I started doing Tai Chi, I've always done Tai Chi pretty regular, but sometimes I'll skip a day or two here, and sometimes you're really busy, you might skip a week. If you're around sick people, I get sick. Since I've been very rigorous and religious, really, about doing it daily over the last 5 years, I have been around a lot of sick people. I've not had a single cold or flu. Sometimes I'll push it a little bit just to see. My wife will be sick because she's Irish. She needs that fast pace. She's going to do a martial art. She wants to hit something. But so Tai Chi, he does require a little bit of patience there. But when she's sick, I'll give her a kiss. She says, you don't want to get my cold. It's like, no, I do Tai Chi. And no guarantee, no absolute promise, but I haven't gotten sick yet. So it's kind of nice. It's kind of interesting to kind of push it along that line. No, don't recommend it per se, but. So that brings us, I wanted to end with, again, dosage. I really want to address dosage. With my student, Karen, at that point, I hadn't really been looking at anything. She's what got me looking in this direction and researching hypoxia and oxygen saturation and the effects of Tai Chi in the body with oxygen-based metabolism. So I don't know how much she was practicing. I never really followed up with her. I don't know if she's doing this daily, if she's doing it multiple times a day. I don't know if she got better and let up practice, and that's why the cancer returned. But Helen, her father was a Kung Fu and Tai Chi master. And he thought, my daughter, chemotherapy failed, she's dying, the doctor said she has 2 weeks. I'm going to have her do this every day for 8 hours a day. So she was doing these exercises for 8 hours a day, and her cancer cleared up. And 17 years later, she's still alive. So dosage is something that you need to look at. If you have a specific condition, you may need to increase your dosage to 2 or 3 times a day. Then you get better, maybe you can go to a maintenance level of 1 time a day or twice a day. If you don't have a chronic condition, 1 time a day may
For how long?
That also needs to be researched. I know I'm going to share a personal story here. We're going to end on this note. I have celiac disease. And celiacs, as they develop into their 50s, they tend to develop celiac neuropathy where they can't feel their hands or feet. Started getting that. It started getting so bad, it's a genetic disease, I can't digest gluten, it acts like a poison on my body. So if I get any kind of contamination from anywhere, it essentially poisons my body. I got to this point where I could barely feel my legs and arms, and I thought, am I going to end up in a wheelchair? This really bites. And then I thought, dosage. I'm doing Tai Chi once a day. So I started doing Tai Chi for half an hour in the morning, afternoon, and night. It cleared up. I'm down to, again, maintenance dosage where I'll do it in the morning, usually at night. And sometimes I'll feel a little bit of numbness in my tips of my fingers or toes, but the condition's completely cleared up. So regarding how long you need to do it, that's going to be something that's going to take some personal experimentation. You do maybe half an hour a day. For people who are in good health, you'll find that you get a lot of benefits for stress and blood pressure and a lot of other things. A lady in the office, all of her coworkers were on medications for stress. She didn't want to do that. She started Tai Chi, and she says she's in better condition than her coworkers are on all these medications. And I know she's probably doing it 20, 30 minutes in the morning, or is it most typical time, or maybe 2 or 3 times a week. Again, I know a lot of these people, they list their stories on the internet. I've collected hundreds of these stories. They don't always tell you how long they've been doing it for, and that's something that we need more research. But it's something that you can experiment with and see when do you get those benefits if you have specific conditions. If you're looking for health, it's something that just 20 minutes a day, traditionally, this is an exercise you do for, if you do the whole Tai Chi form, it takes you about 20 minutes. You add in like the 8 treasures Qigong form, you add another 10 or 15 minutes. And that's a pretty typical practice, usually every day or every other day for a lot of people. And they're very healthy people. I'm not going to get into this, but we're out of time, more than out of time. But all the physiological benefits for the body, Tai Chi also acts as a form of meditation, which has very specific effects on the mind. And the benefits for the mind, which can have implications from everything from Alzheimer's and dementia to stress and memory and function, is tremendous.